Good morning, everybody. We had 85,000 tests to 8 p.m. last night. Thank you to all those citizens who keep coming forward to getting tested. That helps us immensely to make sure we're capturing all the cases of community transmission. There were 172 cases of community transmission to 8 p.m. last night, and unfortunately 60 of those cases were infectious in the community. And I just want to call out the consistent messages we've been giving, because time and time again cases are popping up in workplaces amongst workers in those critical places of employment, but also in households. And tragically, I want to extend my condolences to the families and loved ones of the two older women who succumbed to the disease yesterday. Unfortunately, they were household contacts that they got the disease from, and they weren't vaccinated. And my message is to everybody, please come forward and get the vaccine. Not only are you protecting yourself, but you're protecting those closest to you. Can I also reiterate a message we've been giving consistently? If you have to go outdoors to undertake necessary shopping, please go in and out. Please think about what you're purchasing. Please have that designated person and make sure the trip is as short as possible and that you're not coming into contact with many people at all. I also, from yesterday, Dr. Chan's announcement, want to convey that pleasingly from tomorrow, we have increased our presence of pharmacists in southwestern and western Sydney providing vaccinations. And from tomorrow, over 18s will be able to access the vaccine in pharmacists. And from Friday, our New South Wales health hubs will be able to take bookings from people over 18 years of age for the AstraZeneca vaccine. So this is positive news in line with the health advice. So I'm asking everybody to come forward and get the vaccine. We know the vaccine protects against serious illness, but also reduces how contagious you are, and that is really critical moving forward. Can I also stress in relation to the local government areas of concern that we've been consistently highlighting? We're now seeing the virus become more prominent in Western Sydney than Southwestern Sydney. Of course, we want to ask the Southwestern community to stay vigilant. In particular, I want to call out and thank the Fairfield local government area who've shown a positive result in declining number of cases. But now we've seen adjoining councils in Western Sydney increase the number of cases they have. And we ask for populations in the Canterbury-Bankstown area, in the Liverpool area, in the Cumberland community in particular, and also the Parramatta Council area, to make sure that they're vigilant, they're coming forward to get tested, and you're not leaving the house unless you absolutely have to. And I really want to stress that point. But in addition to following the health rules and the health orders, can we ask everybody to come forward and get vaccinated if you haven't had the vaccine? Don't come out and get vaccinated if you have symptoms. Clearly you need to go and get tested and stay home. But otherwise, we're urging everyone to come forward and get vaccinated. We know that the strategy of restrictions and vaccines will be our recipe for freedom, and that's what all of us are looking forward to. And I'm convinced that if we make sure that August and now is a month where all of us get vaccinated, that we will be able to live life more freely moving forward. And I urge everybody to do that. Dr. McAnulty will now provide the health report, and then we'll take any of your questions. Thank you.
Thank you, Premier, and good morning. New South Wales recorded 172 locally acquired cases to 8 o'clock last night. 87 of these were linked to known cases or clusters, and the source of the other 85 remain under investigation. 3 new cases were acquired overseas in this period. There have now been 2,397 cases associated with cluster since the 16th of June. There's been 84,486 tests done yesterday to 8 o'clock last night. As Premier mentioned, of the 172 cases, 61 were in isolation throughout their infectious period, 19 for part of their infectious period, and 60 were infectious in the community. Sadly, 2 people died yesterday following infection with COVID, including a woman in her 80s who passed away in Pendle Hill and a woman in her 80s who passed away in Campbelltown Hospital. In terms of hospitalisations, there are currently 171 patients in hospital with COVID-19. 46 of these people are in intensive care, 19 are being ventilated. In terms of risks, we're concerned about Campsie Centre shopping mall. This has been a key venue of concern regarding transmission. Anyone who attended the mall from Wednesday the 14th of July to Saturday the 24th of July are close contacts, must get tested and isolate for 14 days since they were there. In terms of Western Sydney, 6 cases of COVID-19 have been identified in 3 associated households in an apartment block of 50 units in Blacktown. Western Sydney Local Health District is working closely with the residents in building management to assess the situation and make sure people are tested, and in collaboration putting in measures to address infection control and the health and welfare of those residents. All the residents in that building have been identified as close contacts. As Chief Health Officer mentioned yesterday, there's been an outbreak of cases in Liverpool Hospital. 2 nurses and a student nurse who worked at Liverpool have tested positive to COVID-19. The staff in the geriatric and vascular wards last week. 8 patients have tested positive to COVID-19 and are in isolation, and contact tracing of staff is underway to identify other contacts. The patient was also transferred from Liverpool Hospital to Fairfield Hospital from one of the wards, has also tested positive. 4 patients have been identified as close contacts and are in isolation, and contact tracing continues. Thank you very much.
The health advice is very promising in that regard, and there'll be a message sent out later today, but the community can look forward to positive news in that regard.
And one of the factors was that testing numbers might not be high enough, but what are they at now?
Look, I'll have to get information on what the testing numbers are, but fortunately there have been no additional cases located in that community, and we thank everybody for their patience during that time.
Premier, your Treasurer has said repeatedly that we do need JobKeeper. Is it your position that New South Wales needs JobKeeper?
Well, look, can I just say the New South Wales government continues to talk to the Commonwealth about making sure that we have the right settings in place for support to individuals and also to businesses, and those conversations are ongoing, and I'll leave it at that.
So, Premier, but is it your position that you think we need
look,
JobKeeper?
I will just leave it at that. And obviously the settings beyond July 31 will also determine what we think is appropriate moving forward.
Premier, what are we doing, Premier?
Does that mean that you didn't lock down hard enough?
Oh, look, we have our own course here in New South Wales, and we have a mission to keep our community safe, but also to make sure that we can look forward to living life more freely. And clearly, we're not at that stage yet, and the New South Wales government continues to take the best health advice on the way forward. But can I make this point very clearly that at every opportunity, we will look to have our community stay as safe as possible, but also provide those freedoms as quickly as we can. We're not there yet, and we'll look forward to making further announcements this week on what life beyond July 31 looks like.
In relation to
in terms of the numbers today aren't good. We're now in our 5th week of lockdown. Why do you think that the numbers aren't shifting and they're really going up?
Yeah, I think what we need to consider is, had we not taken the position we had in the last few weeks, including some very difficult decisions around having a pause on certain industries, our case numbers would literally have been in the thousands. There is no doubt about that. And the fact that we've kept the numbers at bay to this extent is something I want to thank the contact tracers and everybody in health. But are they where we want them to be to lift the lockdown? They're not. Are they where we'd like them to be in certain parts of Sydney? They're not. And that's why the New South Wales government will consider the health advice, but also the health advice we've been receiving to date in terms of what life looks like beyond July 31.
Does that now mean specific harder lockdown measures for the West? You mentioned the West is now worse than the South West.
Oh, look, I think what's important to note is that it's been a good time for the health experts to give us good data on how the virus is transmitting and in which way. And consistently we've seen critical workplaces and also households be the main generators of the virus transmitting, and they're the issues we need to focus in on. But it's also clear for us that we need to intensify our strategy to ensure that the population comes forward to get vaccinated. So these are all things that we will be considering when we announce what life beyond July 31 looks like. And I just ask people, I know it's really difficult not to speculate, but please wait till we make those announcements. I'm hoping to make those announcements as early as tomorrow to give people plenty of notice. And I just ask everybody for their patience. I know it's a very difficult and frustrating time, but I also know from the messages I've been receiving and the government's been receiving that people first and foremost want to know that they and their loved ones are being kept safe. But that's why it's really difficult for me to fathom how people would knowingly do the wrong thing and then potentially take the virus home to their loved ones. And that is the strongest message I want to give today. Please know that if you risk getting the virus or spreading the virus, the ones that will be most impacted are those closest to you. And so I just ask everybody to consider their behaviour and their actions in view of that.
Premier, that is the message you've been giving for 5 weeks now. People are still doing the wrong thing and we're still seeing the virus spread in households. Do you need to change your messaging to a harsher message about people doing the wrong thing?
I mean, we are starting to see some positive changes in behaviour between household movements, but more needs to be done. And that's why I think it's so horrible when we need to report a death. It's awful. I mean, I just think about my own circumstances and how I'd react if someone very close to me got the disease and died from it. And the message is starting to get through that if you risk your own health, that's one thing, but then to take it home to your parents or your siblings is just something none of us want to imagine. And I think that message is starting to get through. We've seen some.
A long time though for that message to be sinking in. You know, how can you communicate with people more directly in communities that are doing the wrong thing?
Well, obviously we have great community information at a grassroots level, but it's not just households. Can I please make this point that it's also critical workers in their workplaces? You know, one person takes it home and then because of the contagiousness of the Delta variant, like the entire household is succumbing. So it's not just households, and I want to make that clear. The best health advice tells us it's a combination of workplaces and households, and obviously those settings moving forward need to be considered around that. And we also know that unfortunately, some people are not getting tested early enough. So with the onset of symptoms, please make sure you come forward and get tested. Please make sure that if you're a category of worker that's been asked to get tested frequently, that you do that. And please make sure that you are always updating yourself with all the best health information we have.
Premier, we're seeing
The education sector is suggesting that we should abandon the HSC for Year 12s in effective areas and base their marks off their assessment. What do you make of that suggestion?
Look, can I say the New South Wales Education Department's been doing outstanding work in making sure that we have good plans in place to support our HSC students. And can I please assure Year 12 students and their families that we'll be making announcements imminently about making sure they all know what they can look forward to, and also to know that all of them will be receiving an HSC based on the hard work. All the hard work that they've been doing will be rewarded. So please don't stress if you're a Year 12 student or your family, because I know it's as stressful for parents and loved ones as it is for the Year 12 student, and also for the community of schools, for principals and teachers who put those hard yards in. So please know that all is being recognised, and that I'll have something to say about that positively in the next few days.
It's all very well and good to say that cases, that the measures that we've put in place have seen cases not increase exponentially, but if the target is 0, they're not working. So, and I know you're going to announce as early as tomorrow what it's going to look like in the next couple of weeks, but is part of the reason for the delay in announcing that because you don't know what's going to work to bring that number down to 0? Do you know what's going to work?
We absolutely have really important strategies in place, and I want to assure the people of New South Wales that along with them, I'm looking forward to the day when we can live as freely as we did before this outbreak. And that is my goal and our mission as a government, to make sure we get the right settings to allow us to do that as quickly as possible. Now, there's no doubt the New South Wales Government does need to consider some difficult decisions, but also some decisions which get the right balance for us in some settings, in some areas. So I just ask everybody to just be a little bit more patient in terms of knowing what life beyond July 31 looks like, but also know that every single decision we take is based on the best health advice and based on allowing our citizens to live as freely as we can allow them, but also mindful of the fact that we don't want people in the community infectious with the virus when we open up, because we've seen around the world that when you have too many people who've been infectious in the community and you open up too early, countries that have claimed to have done so well with COVID, which have much higher vaccination rates than ours, have failed with Delta because they opened up too quickly. We know we've put in the hard yards for 5 weeks, and we don't want to waste all the great work we've done by opening too early and then having the virus spread again. And that's why we really need to get that number of infectious in the community down. Fortunately, the settings where people are infectious in the community are far less difficult to deal with than they were some time ago, because where they are infectious, there has been some level of good work practice or good contagion, and so we're able to locate them quickly and the contact tracers are able to get onto them. But there's no doubt that that number needs to come down. If it's not at a safe level before we open up, we do run the risk of having an outbreak that can even be worse than the one we've currently experienced, and I don't think anybody really wants to see that happen.
You danced around and sort of dropped hints about it for the past few days, but can you at least level with people and say there's going to be a lockdown of sorts for at least another couple of weeks?
Oh, look, I would much prefer to have a definite position rather than speculate. The last thing people want is speculation. They want.
But that's
some
not
firm...
speculation. If you know that it's going to take at least another couple.
No. The government has yet to make a decision based on the best health advice on what July 31 and beyond looks like.
The lockdown could be lifted on July 31, Premier. The lockdown could be lifted.
Look, look, one question at a time, please. As I've said consistently, obviously the number of people infectious in the community is not where we need it to be. And what the New South Wales Government is now considering based on the health advice is what the best settings are for us moving forward, given we know where the disease in particular is transmitting in terms of locations, geographies and other related matters. And as soon as the government has finalised all of our decision making around those issues based on the health advice, of course we'll convey that to the community.
So where does that need to be? Talking about safe levels, are we still aiming for zero?
Oh yeah, absolutely. What we've said, what I've said based on the health advice is we need to get the number of people infectious in the community as close to zero as possible before we open up. So obviously, whilst it's always a concern to have people get the disease whilst they're in isolation, but we know that they're not infecting other people, and we know that they're not creating chains of transmission which are undetected. So we've always said that it's really important for us to get that number of infectious in the community as close to zero as possible, so that we don't risk another outbreak when we reopen. I'm sorry?
The Campsie Shopping Centre, an 11-day stretch of a close contact level exposure event. Was that just one person, and how could it last for 11 days? And is that proof that this outbreak is beyond the contact tracing of what we have at the moment?
Yeah, no. Can I say firstly that, of course, resources are always stretched during an outbreak, but I'm grateful for the support we've received from our contact tracers, but also the external support we've received. And of course, the public should not be concerned about our ability to resource what we need. However, I will ask Dr. McIntyre to speak about that specific case, as he has the details.
Thanks, Premier. So with Campsie, it's a community where we had a lot of cases, and sometimes it's difficult to tease out, what the source of the infection was versus where people are just travelling when they're infectious. But over time, it was clear that the number of cases had visited the shopping centre there, and there was transmission identified in a number of shops in Campsie. So as a That's right. It's numerous shops in this shopping mall in a situation where we've got numerous cases in the community.
And do you know how many people were exposed as a result of those positive cases in that shopping centre?
No, I don't have the exact number, but it'd be many, many people in the community. It's a very popular shopping centre, as I understand it. So in these situations, as we get more information, we provide additional information about
Dr.
the venues.
Dr. McIntyre.
South Wales Health website as a public health alert.
So what we do is we interview cases, we identify where they've been in that period, and then inevitably when somebody is exposed, then they take some days to get sick, and then we interview them, and there's always a period between their exposure and identifying publicly and us understanding where they might have acquired the infection.
Dr. McAnulty,
Yes.
there are a number of, if we are going to see an explosion in transmission as a result of the weekend protest, when are you expecting that could happen? Or, you know, if we get to Saturday and there isn't a big explosion of cases, does that mean we've avoided a bigger outbreak? What's the sort of time frame on that?
Whenever we get people in crowds who are shouting or yelling, no social distancing, that is a very dangerous situation for the transmission of COVID. So it depends whether somebody was there, had COVID, and therefore whether they transmitted. Now, we don't know if somebody was there who had COVID or not. So far, we've seen no indication of any cases associated with that, but we're looking very closely at the cases. But it's very clear message is to keep us all safe, we all need to be following social distancing measures, no matter what our views are. It's important that we don't spread this in the community.
They're not likely to go and get a test themselves, given their position on the problem.
So we would urge anybody who was at that protest,
but they don't believe it,
for the sake of their families, for themselves and the community at large, to watch out for symptoms and come forward, no matter what your political views are, come forward for testing to protect yourself and your family and friends. COVID is a serious disease. As we've seen, deaths occur in young people. Young people are in hospital on ventilators at the moment. It's a really serious disease. No matter what you think, protect your friends.
Dr. McAnulty. Dr. McAnulty.
Dr. McAnulty.
Yeah, quite a concerning situation at Liverpool Hospital. The nurses, the two nurses and the student nurse, had they been vaccinated?
So I understand that they were all had received at least one dose, and one had received 2 doses, but the doses were quite soon before the illness.
And that geriatric ward, is it now in lockdown? You know, what's being done to stop the spread in between? There's obviously been a number of infections already.
Yeah, look, it's a very concerning situation, but the local health district is onto it. They're working very closely with the staff and the patients to make sure that patients are diagnosed early and that contacts are identified and put in lockdown.
Dr. Mac, the woman who died at Pendle Hill, she, like the case a few weeks ago, she refused to go to hospital. Is that the case?
Sorry, I didn't quite...
The woman who, at Pendle Hill, did she refuse hospital treatment similar to the situation?
I don't have all the details of that.
Dr. McAnulty.
Was she linked to that event that we had in Pendle Hills? Was she one of the people who attended that?
Yeah, my understanding was that she was linked to a community event, yes.
Were the patients...
Family event, sorry.
Were the patients that were infected from the student nurse and the other nurse at Liverpool, were they vaccinated? Do you have that information?
I don't have that detail. We are collecting that information.
And just on antigen test, just on testing. So I know that the TGA doesn't like antigen testing as much as PCR tests, and we have great testing capacity with the PCR tests. But is there anything actually stopping New South Wales from implementing some of this rapid antigen testing for workers in these 5 LGAs in particular? Is there anything stopping?
No, in fact, that's something we're been actively reviewing. The technology changes all the time. It's been a rapid surge of new technologies in terms of diagnostics in the last year, let alone the last few weeks. So we are working closely to look at where rapid antigen testing might be most useful, for example, in businesses or various industries.
And when could that happen?
So we'll have more to say that in the coming days.
Minister Hazard.
Blacktown, sorry, Dr. McAnulty, just wait. Just Blacktown, the situation there, do we understand how it's spread through that apartment block? Obviously, you're very concerned about that situation.
Yeah, we're very concerned. We know that apartment blocks, there have been transmission in other apartment blocks during this outbreak. So far, we're not aware of transmission within that apartment block, apart from the 3 families who are connected. But we're taking every precaution to make sure that their welfare and they're tested and they're in isolation.
Can I ask about construction? Can I ask?
With the gathering in Pendle Hill of the 50, have any fines been handed out to anyone who was at that gathering in Pendle Hill?
There's been no fines handed out in respect of that incident, but what I can say is that investigators at our Police Operations Centre have information from New South Wales Health. Will allow New South Wales Health to continue with their work to ensure that they can do the very best they can around close contacts and the like, and then police will move in after that to take whatever action they think is necessary.
Minister Hazard, Minister Hazard.
Details from New South Wales Health about the people at that gathering.
At our Police Operations Centre, we have an investigation team. We have a representative from New South Wales Health. That information, as much as we need at this point in time, has been shared, and we have never had an issue with health sharing information when we need it.
Minister, an offer for help with contact tracing from...
Sorry, Lucy, say that again.
An offer for help with contact tracing is now on the table from Queensland. They've said that this morning, that they're willing to help if asked. Will you ask for that help? Do we need that help? I know that you've gone to departments like Transport to get assist with contact tracing. Should we be going and accepting these offers from other states on a greater scale?
The tracing people, or the tracing and case interviewers, are fantastic, and in every state and territory they do a great job. In New South Wales, we have currently about 550 tracers and interviewers who are doing the job, but obviously they can't work 24 hours a day. So they have to be working in various shifts. We've had offers from a number of different jurisdictions, and happily we'll be accepting whatever health decides is necessary. But I am grateful. I mean, I think that goes to what I was saying on Saturday morning about a Commonwealth. I think that working together is exactly what we should do. We sent, when Victoria had some challenges, we sent down quite a large number of frontline health staff. We actually offered tracing, but the tracing was part of the issue. There is to have interoperability in terms of the platforms, and it wasn't quite the way we would have liked at that stage. But we set our staff down. We'll work together with whoever is offering us assistance. But at the moment, the tracers are doing a great job. Happy to accept assistance, and I'll talk to. You're telling me I haven't seen that offer yet, so. It's not unusual to hear it from the media, generally, before I hear it from others, but anyway.
Minister, the Central Coast MP has said that...
you're very quiet.
The Central Coast MP has said that the Central Coast won't be coming out of lockdown because, in part, 150 people from the Central Coast went to that protest on the weekend. One, is that correct? And two, what is the message for the people who are planning to go to this weekend's one in that case? Are you going to ruin it for everybody?
First of all, I can't comment on the numbers of people who went from the Central Coast. I don't know the answer to that. But if there were people who went from the Central Coast, that is not helpful to keeping the local community safe. What I would say more broadly to people who think it's all right to protest smack bang in the middle of a 1 in 100 year pandemic, you are letting yourselves down, but my heavens, you're letting the community down big time. Just back off and let us do our job. Sorry, can I just do Sarah for a second?
Working on the mass vaccination clinics in regional New South Wales, outside of Sydney, Newcastle, Wollongong, or the idea of a travelling vaccination clinic that could pop town to town, utilise town halls, that sort of thing?
Can I say we've got over 100 outreach facilities across the state, including in some of the very remote parts of New South Wales, and we continue to look at what else might be needed. The health team literally are working 18, 20 hours a day looking at all those options. So if they, working with the local community, determine that's necessary, of course it will happen. Sorry.
Can I just ask you about vaccine supplies? Oh,
yes.
And Pfizer. Is there any risk that New South Wales will run out of Pfizer, or have we got enough now? And is there enough in the pipeline that you're confident of getting?
We need more Pfizer. Right now, we need more Pfizer. And the reality is, I think, as I said before, the federal government did their very best, I believe, to try and get contracts for vaccines when, after all, we didn't know, no one knew whether we'd even have vaccines. As I've said many times before, the coronavirus and the various forms that we now have never had a vaccine until this last literally 8 or 9 months. So a lot of scientists, medical researchers came together and fortuitously gave the world a series of vaccines. The federal government did their best, I believe, to try and get the vaccine contracts, but certainly we would have liked, and I remain very much would have liked a lot more vaccine, particularly Pfizer, to be available. But I guess that's with the benefit of hindsight. We've got a lot of AstraZeneca, and people need to understand that we're right smack bang now in the middle of a major issue here in Sydney, and people who are eligible, and that is anybody over the age of 18, should go and get some advice and take the AstraZeneca. I had the AstraZeneca, Premier had the AstraZeneca, the Chief Health Officer had the AstraZeneca. Go and get vaccinated. Vaccine is certainly a major step in getting us out of the current issues that we're facing. And I think, look, it's not just... Sorry.
That's what I'm just asking.
Well,
Will we run out of Pfizer by a certain
sorry,
date?
can I just say, I think that's a bit over dramatic, but in the sense that the federal government has told us we're going to get a certain amount over the next few weeks. But I'd like more right now. The government would like a lot more right now. We had to make a really difficult decision earlier on about whether or not New South Wales would step up, for example, to do a lot to support the federal government in aged care, disability and so on, people with disabilities, and also more broadly. And so the state government has set up mass vaccination hubs that would never have been envisaged previously. That's a lot of time, a lot of money, a lot of effort by a lot of health workers. And we had to do that not knowing, not being guaranteed that we would get the vaccines to actually use those facilities to their maximum capacity. And the alternative would have been to have had no facilities when the vaccine, if it did ever come in great numbers. So we made a decision in our government that we would take that extra step, the precautionary step, have the facilities set up, and we've done it. And I want to thank the staff who did it. They've done an amazing job. But now we're entirely dependent on the federal government's supplies of the Pfizer vaccine. And I have to say at the moment, we know for a fact that we will not have enough Pfizer in the next few weeks to be able to do what we really could do in those hubs. So I think the issue for us now is just to say to the federal government, thank you, we would like some more. As I said on Saturday, we would have liked some help from our other... Sorry, Lizzie. So I would have liked some, we would have liked some help from our state colleagues, but that hasn't happened. So.
What about the national stockpile?
Sorry, I'll come to you, Lizzie. Just do Ursula.
What about breastfeeding women? There was a question yesterday about this, but so pregnant women are supposed to have Pfizer. Breastfeeding women aren't sure what they're supposed to be doing, and a lot of them are under 40.
Can I get something put out? I know with pregnant women, the health advice out of the specialist group that advised the federal government until recently was to not have it, but more recently they've changed that advice and said that Pfizer can be taken. But I'm not sure, I assume it's the same for breastfeeding, but I'll get that information from our health people, put it out on the website today.
Then with pregnant women? Should they be in the priority group then with pregnant women, breastfeeding women?
Let me get back to you on that one because we need to work through that. Sorry, no, I just said, sorry Alex, Lizzie first.
You're saying you want more Pfizer. Do you have, is there a national stockpile of Pfizer? Do you know how much is in it? Can we get access to it? Have you approached the federal government about that?
Yes, of course. I understand from the federal government that there's a national stockpile, but no idea what's in it, never been told. Sorry, Alex.
We've obviously seen cases going up, hospitalisations, ICU, ventilators, and now in the past couple of days, we're starting to see quite a few more deaths. Is that the phase of this pandemic or this outbreak that we're entering now? We're going to see a bit of a spike. Is that what you're expecting in the number of people dying?
Look, I think that the playbook that we didn't have last year for the previous variants, in a sense, is now, well, we didn't have a playbook. We haven't got a playbook now either. But you'd have to assume the more people who get the virus, the more deaths we will have. And as we saw very sadly the day before yesterday, a young woman only 38 years old with no other illnesses died. So I think that's why we keep saying, particularly to those in the southwest and west of Sydney where the virus is particularly present at the present time, to be cautious, stay at home. Our government does not make laws or rules to require you to stay at home just for fun. It's to actually keep people safe. So don't go out, don't do anything you shouldn't be doing, and don't go and visit other households. Young people might survive, they might not, as we've more recently seen. But we do know that when they take the virus into a family member or a relatives in another household, they put that older person definitely at risk, and quite probably the younger people as well.
Premier, just on the Premier.
Sorry.
At New South Wales Health Hubs.
Yeah.
Are you planning to give those and administer those to under 40s for AstraZeneca? We've got information.
Can I just explain? The Premier did say that a little while ago, but
so
we say a lot, so I appreciate sometimes so. But the advice from ATAGI has obviously changed a number of times, and I think that has led to a degree of confusion. But what we do know is that it's a risk balance issue, and at the moment there's quite substantial risk in Greater Sydney, and particularly in the west and southwest of Sydney, for people to get the virus. So they definitely are able to get it if they're over 18. They can get the vaccine, but they should talk to their pharmacist, as the Premier announced a bit later, or talk to their GP, or they can come to book into one of our hubs.
Right, so there's just a few extra hoops to jump through for under 40s.
Sorry?
There's just a few extra hoops to jump through for under 40s, or it's the same across the board for everyone. Is there more hoops to jump through for AstraZeneca for under 40s, or it's the same across the board?
No, it's the same. Sorry,
at Health Hubs.
If the AstraZeneca take-up doesn't improve, when do you get to the point when you actually go hardcore and say, if you don't have the AstraZeneca and you do qualify, you can't go to a supermarket or you can't go to this particular place?
You know, I think it's always a balance in a kind and democratic society as to what you do in...
We're locked in our homes at the moment.
...as a 1 in 100 year pandemic, and that's part of the balance. And I think that the messaging that we're giving day after day is to take the community with us, and that's the emphasis that certainly I would have.
Premier.
I know it's an important part of the economy, and you said you wanted to open it again, but how can you possibly do that and then say to people, limit your mobility, because you're going to end up with tradies going all over Sydney?
Well, please know that whatever decisions we take moving forward will be based on health advice and based on safe practice and based on very stringent COVID safety plans. There are still categories of workers that have to undertake the job they're doing, and if that can be managed in a safer way, well then obviously the New South Wales Government will look at that. It's always part of the balance that you strike. First and foremost, keep the community safe, but also allow those who can do some level of activity, so long as it's done in particular locations in a safe way, and we'll have more to say about that. But please know, we're not about taking difficult decisions and then having setbacks. We need to make sure that we prevent any setbacks. We also need to make sure that the settings we have in place are reasonable and based on health advice, but also based on making sure that we keep things going as much as we can, where and when it's safe to do so.
Premier, just on vaccinations, can I get some clarity just on vaccinations, right? So last week, we've been talking about using Pfizer to reduce the disease burden. On Friday, you spoke about extending the time between the first and second dose from 3 to 6 weeks. I just get some clarity from you. Are you extending that time between the first and second dose to 6 weeks? Are you cancelling people's second appointments? And what are you doing to use the Pfizer that we do have for essential workers in southwest Sydney rather than anyone over 40 from the eastern suburbs or other parts of Sydney?
Obviously the health advice from the federal government on Friday changed regarding AstraZeneca. So now that AstraZeneca is made available...
Pfizer, though,
I understand, but I need to put... I know, but I'm answering it to give context to your question, because your question doesn't make sense unless I provide that context. So obviously on Friday, the health advice changed in relation to AstraZeneca, where any adult is able to come forward and get the vaccine, and from tomorrow you can do that from pharmacists, especially in southwestern and western Sydney, and from Friday you can make bookings through New South Wales Health if you're keen to get the AstraZeneca and you're between the ages of 18 and 40. So I just want to make that point clear. In relation to Pfizer, we already had a plan given the Pfizer that we have available, to make sure that we provide it to some critical cohorts in southwestern and western Sydney in particular. We'll have more to say about that tomorrow and in coming days, but at this stage, I just want to stress there won't be a major disruption to bookings that people have, because we know that a large proportion of the bookings that are currently in the system are from people from Western Sydney and southwestern Sydney already. The key for us is getting as many jabs in arms as possible and maximising the dose doses we have. And I just ask everybody to follow the advice we've provided on getting the vaccine, and also we'll be able to provide the community with more information about specific groups of people that we're targeting with the Pfizer in the next few weeks as well, and we'll be able to announce that in the next few days.
Just to clarify that, Premier.
They've been contacted by a principal at one particular school, at a public school, who says if there's a parent at home, regardless if they're working or not, you've got to keep your kids at home. If you're working from home and you can't be attentive to home learning home learning for your child, can you still send them to school if you're at home?
Well, obviously the health advice around schools is the same as it was last year when we had that one lockdown around Easter. And that is that obviously we're asking parents to homeschool and keep their children at home, but we also appreciate there's always a small percentage of parents or caregivers that don't have that ability for various reasons. And we're noticing around the state it's only about 1 to 3% of students that are actually turning up to school at this stage. And we are very pleased that those numbers are relatively low, because unfortunately, as we know, the less mobile everybody is at this stage, the more we're able to get a handle on the outbreak until we adjust any settings. So we're very keen for that to continue, and I just want to thank everybody because...
The particular problem that these parents are facing, they're working from home, but they're very busy with their jobs and they can't attend to the homeschooling needs of their child. Can they then send their child to school and continue to work from home?
But as we've said, the health advice is that as difficult as it is, it's at this stage.
Yes or no?
At this stage, it's safer. As we've said, it's safer for parents to keep their children at home at this stage. But of course, if you have to work outside the home, or you have extenuating circumstances, or there's issues of vulnerability or other challenges, of course, schools are open. But we're noticing around the state that it's only around Greater Sydney, I should say, it's only around 1 to 3% of families and households that are in that situation.
So if a parent is at home, they have to keep their kids at home, regardless of if they're working or not.
I've answered the question.
Premier, just to be clear,
Premier, Victoria is now coming out of lockdown. Have they now shown us up at this? Have they shown us, and should we have gone down harder and faster? They've done 2 weeks. We're here in week 5, and with no sign of things slowing down.
Oh, look, I think it's important to note that every state has had its own course and journey during the pandemic. Victoria is emerging out of its 5th lockdown. And I appreciate people want to make comparisons, but it's also important to note that every state has had its own course. Every state has had its own history of how they've dealt with the pandemic. And it's fair to say that until this point in time, we had our citizens leading a relatively free life as well as staying safe. But there's no doubt the current challenge we have is a serious one, and that's why we're just asking everybody to please remain patient. Please know that we're making the decisions in the best interest of our citizens, and we just ask everybody to please respect and continue to adhere to the health rules.
Just to be clear, you did say we'll get to the point where we stop counting infection numbers but hospital numbers. I know we're not there yet, but when do we get then?
Well, as I said, we get there when we have a much greater proportion of our population vaccinated. And can I stress that vaccination is the key to our freedom moving forward. Whilst we have this outbreak, of course you need a combination of the lockdowns as we've had, you need the restrictions in place, and of course the vaccine, which reduces serious illness but also prevents spread with this Delta strain. But there's no doubt that having high rates of vaccination amongst the population gives you those opportunities which we currently don't have. So I've been keen from day one, as has our government, to get jabs in arms as quickly as possible, and that remains key to our strategy. We are told by the federal authorities that by the end of October we will be awash with vaccine. We have a challenging month or 6 weeks until we get those rates of doses up, and that's why we're encouraging everybody to come forward and to get the AstraZeneca where they can. But obviously we're also asking people to make sure that they are ready to get those vaccines, because more jabs in arms means we have a better outlook for living life more freely. And when I mean more freely, not just about getting out of the lockdown, but looking forward to having international borders come down, having a much freer existence. And that's when we can start measuring the number of hospitalisations rather than the number of cases. But when the vast majority of our population is still exposed in the way they are because we don't have those jabs in arms, that's not an option we have now. But that is an option we're looking forward to, and I want to be very clear about this. I want August to be the month where everybody comes forward and gets the jab jab. I don't believe that people should sit back and wait. If you're able to have the vaccine, if there's no reason for you not to come forward and have the vaccine, please do so. If you're worried about your health, please check with your GP if you have underlying conditions or you're concerned. And I appreciate there's always a percentage of the population in that situation. But for the vast majority who are healthy and want access and want to keep themselves and their families safe, please come forward and get vaccinated. That is key to us. Also being able to see what September looks like for New South Wales and what the following months look like for New South Wales. And I don't think anybody can deny that the vaccination rate is absolutely linked to how we live life with the Delta strain.
Premier, just to be clear, Premier, when you said on Friday that you were going to extend the second dose of Pfizer from 3 to 6 weeks, you're not doing that anymore because of the change in a target advice recommending anyone over 18 seriously consider AstraZeneca?
No.
You're not doing the extended...
No, can I say Dr. Chant presented that advice. It wasn't myself. It was actually Dr. Chant that presented that advice from a health perspective, that as an option she has. That's not yet been recommended to us by her formally because of the changing health advice. So obviously the health experts are looking at the results of the changing advice, looking at the number of doses we're likely to get, and they will make those decisions. But at this stage, the health experts, including Dr. Chant, have not advised us to do that.
Do you need more incentive for people to come forward and get the vaccine?
But
Like giving them special consideration?
I think at the moment, the best incentive all of us have is to protect our loved ones.
Is that enough, though?
At this stage, absolutely. We are not awash. We are not awash with all types of vaccine. But I think the incentive now is for people to come forward and protect themselves. When you have a major outbreak, the risk and the benefits change. So people now are more likely to get COVID than they are to have adverse reactions from a vaccine. And that's why it's so important for people to assess the risk in the current environment. And the current environment is that we have the virus lurking in some communities more than others. But we ask everybody to consider the risks based on how prevalent the virus is amongst certain communities.
Under the current rules, or my reading of them, so correct me if I'm wrong, but if you have a second home that you own in another part, you are actually allowed to travel to it. Is that not creating undue risk there?
I'm not sure of that, of those circumstances, but the bottom line is you're not supposed to leave the house you live in. You're not supposed to leave home where you live unless you absolutely have to. And I think people are pretty clear about that. Only leave if you must, if you're a critical worker, or if you have to go and get essential groceries for your family. And in that case, it should be the same person so that there's not multiple exposures and people going shopping multiple times. We're just asking people alongside the health orders to demonstrate real constraint. Please limit your activities. We are doing the hard yards now so that we can live more freely down the track. And we know that the next few weeks are going to be extremely difficult for New South Wales. And we just ask people to please acknowledge the risks that we have, to acknowledge the fact, even though I know it doesn't get reported as much, but the fact that we've prevented thousands and thousands of cases is something that we can at least cling on to, because we know that had we not done the hard yards, given how the virus is spreading and how fleeting the transmission can be, that we've done well under the circumstances compared to other places around the world. And I just urge everybody to stay vigilant. Please stay the course. Please don't think you can let your guard down, because at the end of the day, as I say consistently, even if it's not your own, if you think you're immortal somehow, if somehow you think you're special and you're not going to get the virus, your parents to them. We don't want to see more of that. So even if you don't have regard for your own health, or you think somehow you're not going to get the virus, please know that people in and around you, your household, a work colleague in a health setting or in a grocery store, can be susceptible and vulnerable, and just think about others apart from just yourself. Thanks, everybody.
Thank you, guys. Thank you.